In the digital age, the healthcare industry has made significant strides in leveraging technology to improve patient care, streamline operations, and enhance overall efficiency. Electronic health records, EHRs, telemedicine, and Internet of Things, IoT, devices are just a few examples of technological advancements that have revolutionized healthcare. However, with these advancements comes an increased vulnerability to cyber threats, particularly ransomware attacks. Ransomware, a type of malicious software designed to block access to a computer system until a sum of money is paid, poses a significant threat to healthcare IT systems. The consequences of such attacks can be devastating, impacting patient care, data security, and financial stability. This blog post delves into the dangers of ransomware in healthcare, illustrating why it is crucial to shift our mentality towards cybersecurity to protect this critical sector. What is ransomware? Ransomware is a form of malware that encrypts a victim's files, rendering them inaccessible until a ransom is paid to the attacker. The ransom demand often comes with a deadline, and failure to pay within the specified time can lead to the permanent loss of data. Ransomware attacks can be delivered through various means, including phishing emails, malicious websites, and exploiting vulnerabilities in software. Healthcare organizations are particularly attractive targets for ransomware attacks for several reasons. Critical nature of healthcare services. Hospitals and healthcare facilities provide essential services that cannot afford prolonged downtime. This urgency increases the likelihood that an organization will pay the ransom quickly to restore operations. Sensitive data. Healthcare providers store vast amounts of sensitive patient data, including personal identification information, medical history, and financial details. This data is highly valuable on the black market, making healthcare organizations prime targets for cybercriminals. Complex IT infrastructures. The healthcare sector often relies on outdated and disparate IT systems, which can be challenging to secure. The integration of various devices and platforms increases the attack surface, providing multiple entry points for attackers. The impact of a ransomware attack on a healthcare organization can be profound and multifaceted. Disruption of patient care. Ransomware can cripple healthcare IT systems, leading to the inability to access patient records, schedule appointments, or perform diagnostic tests. This disruption can delay treatment, compromise patient safety, and even result in loss of life in critical cases. Financial losses. Beyond the ransom payment itself, healthcare organizations face significant financial losses due to operational downtime, remediation costs, legal fees, and potential fines for data breaches. The cost of restoring systems and recovering data can be exorbitant. Reputational damage. A ransomware attack can severely damage the reputation of a healthcare provider. Patients trust healthcare organizations with their most sensitive information, and a breach of that trust can lead to loss of confidence and a decline in patient numbers. Regulatory and legal consequences. Healthcare organizations are subject to strict regulations regarding data protection, such as the Health Insurance Portability and Accountability Act, HIPAA, in the United States. A ransomware attack that results in a data breach can lead to substantial fines and legal action. In May 2017, the WannaCry attack became one of the most notorious ransomware attacks to date, affecting over 200,000 computers across 150 countries. The UK's National Health Service, or NHS, was particularly hard hit, with more than 80 hospitals and healthcare facilities impacted. This attack disrupted surgeries, appointments, and emergency services, starkly highlighting the vulnerability of healthcare IT systems to ransomware. Moving to the period between 2018 and 2019, the Ryuk ransomware campaign targeted several healthcare organizations in the United States. In one notable incident, a major hospital system in Alabama was forced to shut down its IT systems, resulting in the cancellation of elective procedures and the diversion of emergency patients, underscoring the severe consequences of ransomware on healthcare delivery. During the COVID-19 pandemic, the healthcare sector faced an unprecedented surge in cyber attacks. Cybercriminals exploited the crisis to launch ransomware attacks against hospitals, research institutions, and vaccine manufacturers, further straining already overwhelmed healthcare systems and emphasizing the need for robust cybersecurity measures. Historically, cybersecurity in healthcare has often been reactive rather than proactive. Organizations focused on responding to breaches rather than preventing them, leading to a cycle of vulnerability and exploitation. To combat the growing threat of ransomware, a paradigm shift is necessary. Healthcare organizations must adopt a proactive approach to cybersecurity. This includes regular vulnerability assessments, penetration testing, and continuous monitoring of IT systems to identify and mitigate potential threats before they can cause harm. Developing and implementing comprehensive security policies is crucial. This involves not only technical measures, but also administrative controls, such as employee training and awareness programs to prevent phishing attacks and other social engineering tactics. Furthermore, the healthcare sector must invest in advanced security technologies, such as artificial intelligence and machine learning, to detect and respond to threats in real time. These technologies can help identify unusual patterns of behavior and potential indicators of compromise. Lastly, adopting a zero-trust architecture, which assumes that threats can exist both inside and outside the network, can enhance security. This approach involves strict access controls, continuous verification of user identities, and segmentation of networks to limit the spread of ransomware. Combating ransomware in healthcare requires a collaborative effort among various stakeholders. Industry collaboration. Healthcare organizations should collaborate with industry peers to share threat intelligence and best practices. Information sharing can help identify emerging threats and enable coordinated responses. Public-private partnerships. Governments and regulatory bodies should work closely with the private sector to develop and enforce cybersecurity standards. Public-private partnerships can facilitate the exchange of resources and expertise to enhance overall security posture. Patient involvement. Patients also have a role to play in cybersecurity. Educating patients about the importance of data security and encouraging them to report suspicious activities can help healthcare organizations detect and respond to threats more effectively. Strengthening regulatory and legal frameworks is essential to ensuring that healthcare organizations prioritize cybersecurity. Enhanced regulations. Governments should introduce and enforce stringent regulations that mandate robust cybersecurity measures in the healthcare sector. Compliance with these regulations should be regularly audited to ensure adherence. Cybersecurity insurance. Encouraging healthcare organizations to invest in cybersecurity insurance can provide financial protection in the event of an attack. Insurance policies should require organizations to implement minimum security standards, incentivizing proactive measures. Legal consequences for cybercriminals. Governments should pursue and prosecute cybercriminals to the fullest extent of the law. Strengthening international cooperation to track and apprehend cybercriminals can deter future attacks. To safeguard against ransomware attacks, healthcare organizations should implement the following practical steps. Regular backups. Regularly backing up critical data and ensuring that backups are stored securely offline can help organizations recover quickly from a ransomware attack without paying the ransom. Patch management. Keeping software and systems up to date with the latest security patches is crucial. Many ransomware attacks exploit known vulnerabilities that could have been prevented with timely patching. Incident response plan. Developing and regularly testing an incident response plan can ensure that healthcare organizations are prepared to respond effectively to a ransomware attack. This plan should outline roles and responsibilities, communication strategies, and steps for recovery. Employee training. Conducting regular cybersecurity training for employees can help prevent social engineering attacks. Employees should be educated about recognizing phishing emails, suspicious links, and other common tactics used by cybercriminals. Access controls. Implementing strict access controls and the principle of least privilege can limit the spread of ransomware within an organization. Users should only have access to the data and systems necessary for their roles. Network segmentation. Segmenting networks can prevent the spread of ransomware and limit the impact of an attack. Critical systems should be isolated from less secure parts of the network. The threat of ransomware in healthcare. IT systems is real and growing. As cybercriminals become more sophisticated, healthcare organizations must evolve their cybersecurity strategies to protect patient data, ensure continuity of care, and maintain trust. By adopting a proactive approach, investing in advanced security technologies, and fostering collaboration among stakeholders, the healthcare sector can build a robust defense against ransomware attacks. It is imperative that we change our mentality on cybersecurity, recognizing it as a critical component of patient safety and organizational resilience.